We are going to install an Optragate. It is simply a mouth guard or a mouth retractor, allowing lips and cheeks to be retracted. This is the regular version and the small version. In the case of this patient, we are going to use the small version. We are going to moisten the ring to insert it in the mouth. To install the Optragate, I moistened it slightly to make it a bit suppler. First, I will place this rigid part in the left cheek. Then I am going to insert the other part in the right cheek. I ask the patient to slightly close her mouth in order to position the lips over the ring, and I repeat this step for the upper lip. I position the lip over the ring. We slightly open the patient's mouth so it is cleared appropriately. This way, the opening is unobstructed, allowing us to choose the right impression tray. To the patient, open wide. In this case, the impression tray will fit well. And the bottom part, to the patient, open wide. We have the appropriate impression tray for the lower jaw. We are going to take the first impression of the upper jaw with a 3M impression tray used for the pentamix. I'm going to mix the paste. We will fill the impression tray. We only need the teeth. The paste is ready. We lightly spread the paste so it is uniform in the tray. We are going to put it in the patient's mouth. We position the impression tray, and then we press it on the teeth, and we make the paste seep slightly over the trim. We must hold the tray during 1 minute and a half. Once the 90 seconds are over, we are going to remove the tray by allowing a bit of air in. This is a vinyl polysiloxane material by Pentamix called Position Penta Quick, TM, and it gives a beautiful impression of posterior and anterior teeth. Even if there's no precision for anterior teeth, it is not important to design the appliance or the mandibular advancement device. For the upper part, we mainly need the teeth, from the canine teeth to the molar teeth. We are now going to proceed to the impression of the lower jaw. We fill the lower impression tray. We spread the paste for it to be uniform. And we are now going to insert the tray in the mouth. To the patient, for the insertion, please open wide. We insert the left side and the right side. We press on it, and we ask the person to hold up her tongue against her palate, so it is released from under the impression tray. We are going to keep this position for 90 seconds. There are a few seconds remaining. We are now going to remove the tray by letting in some air and by taking it off slowly. Then we remove the whole thing. Here it goes. We obtain an impression with details of the posterior and anterior teeth. There are clear details at the vestibule level. We do not need to have the whole vestibule, but there must be a few millimeters around the tooth collar for the impression to be considered of good quality. We are going to pour these impressions in order to send them to the laboratory.